Hi, guys. Welcome back. My name is Dr. Samantha, and I'm the maternity mentor. And we're here for another one of our live Q&A sessions that we have every Monday at 9 p.m. Eastern Standard Time. This is your chance to interact with me live and me to interact with you. It's also my chance to talk to you guys about any questions you might have right now. So please feel free to put any questions into the chat. It's also a chance for me to answer any questions that you guys might have put onto some of the videos this week. We are also on Facebook, Instagram, and Twitter for additional content. You can see links for those in the description at the end of the video. And then just remember, if you can, please hit the like and subscribe button. So subscribing to the channel really helps me out, and I really, really appreciate that. I'm going to go ahead and I'm going to get started with some of the questions that you guys have submitted this week onto the videos. If you guys have any questions, remember, please feel free to put them right into the chat. All right. So let me go ahead. We've gotten a lot of interesting questions this week. So the first question we're going to start out with is a bleeding question. So, hey doc, I'm 40 years old and I'm 7 weeks pregnant. I had light spotting 2 weeks ago already. I have been to the doctor in my 6th week and the baby is fine. I don't understand why the spotting didn't stop. What should I do? So, bleeding is one of the biggest topics that I get asked about, and for very good reason, because women are not supposed to bleed when they're pregnant. Okay. We always hear about how bleeding is very not good. Okay. But there's actually a lot of reasons why you can bleed during pregnancy. So, for starters, in the first trimester, there's tons of stuff going on. Your body's getting used to the hormonal shifts that are necessary for you to be pregnant successfully. But not everybody's body reacts the same. So some women will actually continue to get their period for the first month or two, even after they've become pregnant, and the baby can be just fine during that. Secondary to that, you may also find that you have some spotting and or bleeding after sex, especially if you've had an orgasm during sex. That causes some uterine contractions, and the uterine contractions can push out blood. Infections are also a very common cause of bleeding. Now, infections are obviously not a good thing. We don't want you to have any kind of vaginal infections or uterine infections while you're pregnant. But if we find out that there is an infection going on, we can go ahead and we can treat that. So that's why it's really, really important, guys, that if you find out, like if you see spotting or bleeding, you want to go get it checked out right away. So usually what they're going to do is they're going to do an ultrasound. They're going to do an ultrasound to check things out and see, what's going on, how's the baby doing. They may also do some blood work to see if your hormone levels are good. But it's very essential that you have this check to make sure that things are going well for you. Now, the other thing is that once we are able to start monitoring you, we can tell you stuff to look for. For example, we have a video on the colors of bleeding. And so the colors of bleeding are very important. When you have just a light pink, that's oftentimes a tiny bit of blood mixed with maybe possibly semen, normal vaginal fluid, urine, all these other things. So the hormones that are needed for pregnancy, they also thin and dry out the vagina. So you can actually just have a tiny bit of spotting coming from wiping too hard or something else. And if you know that the light pink is usually just a tiny bit of blood mixed with some fluid, this is very important data for your healthcare provider so they can make a decision on how to proceed. Red bleeding is the most concerning because that's active bleeding usually. And then brown is old blood. This usually means that you were bleeding at some point in time and now you're no longer bleeding. So it's just very important that you guys take a look at what's going on and you ask your healthcare provider, what should you do next? If you don't have a healthcare provider set up, if you're not sure what to do, go to the nearest hospital so that they can check you out. They can do the ultrasound and the blood tests and all that other good stuff to make sure that you're doing well. And as far as what to do to stop it, unfortunately, without knowing what the cause is, there's nothing you can just proactively do. We need to figure out what's going on first. All right. So we had a question on antibiotics, and I love the antibiotic questions because, like I just said, leading from bleeding into other things, there's so many things that can cause bleeding, including infections. And if we treat infections early, we can actually help prevent, say, a miscarriage due to infection. So there's different kinds of infections: bacterial, viral, fungal, yeast, and even urinary tract infections, which are in the urinary system. So there's a lot of reasons for us to check things out and see what's going on. So this question: I'm 9 weeks and 2 days pregnant and was prescribed clindamycin 300 milligrams twice a day for BV. Is it safe in my first trimester? Okay, so BV is bacterial vaginosis. So this is a bacteria. What's very important when you're starting to make decisions about taking an antibiotic is knowing, is this the right medication for you, right? So if you have a yeast infection, an antibiotic is not going to take care of that at all. So you want to make sure that you have a bacterial infection if they're going to give you antibiotics. Now, clindamycin is safe for use during the first trimester when the risks outweigh the benefits. Okay, so the risks are usually very minimal with clindamycin. You can get, it might not work, you might get like a rash, stuff like that, but the benefits are you treat this infection. Now, one of the things that's very important with antibiotics is that you are taking antibiotics for the full amount that it's prescribed. So this is what I mean. Antibiotics are usually prescribed anywhere from 3 to 10 days. Usually 7 to 10 days is common. When you first take an antibiotic, though, within like 24 hours, most women start to feel better. Like, it's amazing how well these things make you feel better, which is really cool. But the problem is it's only killed the first line of bacteria. So if you imagine it like an army, you have all these different layers of bacteria. So while the antibiotic is going to be taking care of the front end, at the back end, these guys are paying attention to what this antibiotic is doing. They're learning its tricks and they're learning how to defeat it. Okay. Now, in addition, these guys are building up a wall or a defense against this antibiotic you're taking. So now, let's say you take your antibiotic for a day or two. You start to feel better and you're like, oh my gosh, I don't want to take any more because, what about the baby? And I don't want to take meds and I feel better. So I don't need any more. So you stop. Well, all of these guys, right, are no longer, but these guys are there. They've called for reinforcements and now they've built up a wall. And within a couple days, this bacteria is attacking your immune system. Now you feel terrible again. You feel very sick, very ill. It's just awful. And there's a wall up. So the antibiotic we originally gave you no longer works. This is antibiotic resistance. So it's very important once you commit to taking an antibiotic that you take the entire amount. Because if you don't and the infection comes back, remember, this puts you at risk for miscarriage, stillbirth, and preterm birth. So now we've got to try to use a stronger medication, which might have more risks for your baby. So it's better to take everything that we give you. Now, how do you find out? So she has bacterial vaginosis. So bacterial vaginosis is an infection that's usually caused by a pH imbalance that allows for this particular bacteria to grow and become more prevalent in the vagina. Okay. A lot of people call it a sexually transmitted disease. It is not a sexually transmitted disease. However, this bacteria can be found on skin. So it can be found on our skin, but it can also be found on your male partner's skin. Additionally, male semen, when it's introduced into the vagina, does change the pH of the vagina. So if you had that bacterium present and the pH changes, this puts you at risk for this infection. Okay. So it's very important that you understand that. Now, super easy to treat, super duper easy to treat. What you want to do is you want to go ahead and you want to go to your doctor. What are the symptoms? Usually it's some kind of discharge as well as a smell. Now, if you have any kind of discharge during your pregnancy, it's extremely important that you go get it checked out. What do? Well, we'll do a vaginal exam. And during that exam, we'll take a cotton-tipped sterile swab and we'll swab the vagina for like the secretions and send it off to the lab to determine what we're dealing with. because again, we need to know what is the actual discharge from. So once we do that, we will give you the right medication. So, getting back to this question, yes, this is a medication you can use. It's very important to treat that infection. Now, I'm going to actually lead into a different question that also has to do with antibiotics. So this was on our urinary tract infection video. So this one said, I'm 11 weeks pregnant and I got tested the other day after having endless lower abdominal pains and I have a terrible UTI. My doctor prescribed azithromycin, which is also called Zithromax, cefixime, which I hope I'm pronouncing that correctly because that's a hard one for me, tabs at 200 milligrams, Parapin 650, paracetamol tabs, Gynafort pessaries to insert. Are the above meds safe? So I love this question. Okay. So the answer is some of them I know and some of them I don't know. So for the azithromycin, okay, and the cefixime, those are two antibiotics that are safe to use during pregnancy as long as the benefits outweigh the risks. They're very commonly used for infection. We see it all the time. They're very effective and they usually do not have any impacts on you or the baby except to cure your infection. So they're very good meds, okay? Paracetamol is Tylenol in the United States. Paracetamol is the term that's used in other places. Paracetamol, Tylenol is safe for use during pregnancy. It's for pain and it is for fever. Okay, if you are not in pain and you do not have a fever, you should not just be taking paracetamol. The other thing is you want to make sure you take it exactly as directed. If you take too much, it can actually cause liver failure within as little as 24 hours, okay? So even though it's a medication that's commonly found on the shelves, you cannot just take as much as you want. You need to follow the directions, okay? Now, there are two other meds here, Parapin and Gynafort pessaries, okay? So these are two medications that are not used where I practice, okay? These are not medications that I'm familiar with. So I cannot comment on their safety. So what do you do if you're not sure? A lot of women are faced with a very challenging situation if they haven't found a provider they trust, and so they're ending up in an emergency room or an urgent care, or maybe maybe you have found a provider that you like, but you're just not confident in the explanation that they're giving you. For a variety of reasons, you may not be sure what to do. So where do you go? Because this is a very important decision that you're making to put a medication into your body and treat an illness. So the other place that you can go is your local pharmacist. So your local pharmacist has specialized training in medications and medicating all parts of the population, including women. They have access to databases, just like I have access to databases. We don't memorize all of this stuff. It's not appropriate for us because new research comes out all the time. And when I say research, I shouldn't say research. We can't research medications on pregnant women and breastfeeding women. But what we get is anecdotal evidence from women who've taken them and then they've been studied and stuff has been submitted. So your local pharmacist is another great resource to get a second opinion. If you're really not sure, they're the ones that can look up drug interactions. There's the ones that can look up safety profiles. They have a lot of good information and resources for you. And that's where you go if you are not confident with the opinion that your healthcare provider gave you. Okay. The other thing I want to tell you guys is that in this viewer's question, she talks about pessaries to insert. So these are usually basically like a little, like a capsule almost. And there's tons of medication capsules that can be introduced vaginally. So it's very important. You can find stuff over the counter too, like yeast infection treatments. Do not insert anything into your vagina that is a medication without talking to your healthcare provider first. First of all, the vagina is highly vascular. So what does that mean? It has lots of blood vessels. So as a result, medication absorbs there very quickly. So if you insert a medication that you should not be using, it's going to absorb very quickly, and then we're going to have to deal with whatever the side effects are of that medication. Now, secondary to that, it's also important, depending on your risk profile, to make sure your healthcare provider wants you to insert something. So in this case, this viewer, obviously their healthcare provider was fine with it. But if you were thinking about taking a yeast infection product over the counter, and maybe even you took it during your last pregnancy, so you're like, oh, I know it's safe. Well, you shouldn't assume that. Every pregnancy, every time, check with your healthcare provider. So when you're inserting something vaginally, if your hands are not clean, you can insert infection, okay? Because our hands are great vectors for like bacteria and funguses and all sorts of other stuff. So you need to make sure that your hands are nice and clean before inserting anything, especially if you're at high risk for infection. So this is why you always want to check with your healthcare provider. For those of you who are joining us, welcome, welcome. Please feel free to put any of your questions into the chat. While we're getting started here, I'm answering some of the questions that I've gotten on some of the videos this week. So moving right along with meds, depression video is another one that I get a lot of questions on, and I'm really very grateful because this is one of my passion areas. I work in psychiatry now. I am pregnant and my doctor prescribed protriptyline 10 milligrams and Zoloft. Can it be used in both combinations? So I kind of looked at this question. I'm not 100% sure what this question is asking. So I'm going to kind of say a couple things. First of all, if the combination means the two together, it usually is. However, protriptyline is not a medication I'm familiar with. So either that's a medication that's used in other countries and not here in the United States, which is possible, or that medication was misspelled because there's a whole class of medications called triptylines, which we don't try to use during pregnancy. And maybe they're just referring to one of those and it was misspelled. But I will tell you in general, we don't use the triptylines during pregnancy or postpartum. Zoloft is very commonly used during pregnancy. So Zoloft is an SSRI, that's a serotonin selective reuptake inhibitor. It boosts serotonin, which is a neurotransmitter, a chemical in your brain that helps with your mood. Zoloft is indicated to help with anxiety, depression, panic, OCD, and some social anxiety. Okay, so it's a great drug. And it's really, really got a good safety profile during pregnancy and breastfeeding. Why do we use Zoloft so much? Hard to say. Somebody somewhere started with Zoloft and it really was well tolerated, and that's our go-to. Zoloft does have a couple risk factors. The biggest risk factor, and they're all related to mom, but the biggest risk factor is it does have a high incidence of sexual side effects. So it's actually not one that I reach for first in regular practice. However, when you're talking about the pregnancy and OB world, it is commonly used. And a lot of times we just reach for that because moms will have the most confidence in it. Because not that I want you guys using Professor Google, but if you Google stuff, you are going to find Zoloft more often than not as the number one for pregnancy. So as far as pregnancy goes, Zoloft's a great one. As far as the other one, I can't comment. It's not used in where I'm at. The only other thing you should know about SSRIs and Zoloft. So a lot of people will say, oh my God, but the baby at the end, there can be issues. What they're talking about is something called withdrawal syndrome. So withdrawal syndrome is extremely scary sounding, okay? Withdrawal syndrome is where, so the baby gets little tiny bits of the serotonin through the placenta. That's common. So your baby's getting little tiny bits of Zoloft. It's fine for baby. But unlike you, when you deliver, you're still taking the Zoloft. The baby's placenta, which is where they were getting that Zoloft, gets completely cut off, okay? So like almost immediately, that baby is no longer getting Zoloft. And so the baby all of a sudden has this drop and gets a little kind of irritable, may cry more, may have a high-pitched scream. It may be even shaky, like the hands may be shaky. This all goes away very quickly, okay? Within about 7 to 10 days, the baby has resolved. If you breastfeed, the baby will get little bits of the Zoloft in the breast milk, and that can actually help mitigate withdrawal syndrome. And then finally, providers like myself will sometimes help to titrate your medication. That means change the dosing right at the end. So we lower it. And then as soon as you deliver, we raise it back up and we encourage you to breastfeed. And that helps the baby as well. So there's a lot of ways to manage withdrawal syndrome. What I can tell you about depression and anxiety meds during pregnancy is that the evidence shows that untreated anxiety and depression can put you at a 5% increase or more, or 5% risk or more for preterm birth, miscarriage, birth defects, all low birth weight, all sorts of other things. When we treat depression and anxiety effectively during pregnancy, it reduces your risk of a lot of that stuff. And so it's really important to evaluate all of this when we're making decisions about medication. Okay, so we had a really good question on pumping. So I've breastfed all my babies. Now I'm having issues pumping. My son was born premature and latches, but not for long. I'm not sure because he's so tiny and hasn't learned how to nurse, or because he was in the NICU for over 10 days. And I was there every feeding, bringing breast milk, but they would feed him through a bottle once his feeding tube was removed. Now I've noticed I'm not getting as much milk as I used to when he was first born. I have the Medela pump, but I feel it isn't working properly. So I ordered a new one. I'm just worried my supply is going away. Mommy guilt is real right now. I've watched many videos, but I'm doing everything everyone suggests. Okay. So as many of you guys know, I am a lactation consultant. I've been a lactation consultant for 12 years, maybe 13 years at this point. I'm very pro breastfeeding. I'm also very pro formula. Okay. So for any of you formula feeding moms or those considering formula, there's absolutely no judgment. I feel like feeding your baby is your choice, and we're supposed to be here to support you. But many of you who might be pregnant and not sure where you're going to go, you hear about breastfeeding all the time, how good it is for the mom, how good it is for the baby. And once you have that baby and those hormones start surging, a lot of women who say they're only going to formula feed end up trying. And then if things don't go according to plan, mommy guilt sets in, as is happening with this viewer. So the first thing I'm going to tell you is, as long as you are taking care of your baby, you're feeding your baby, you're keeping your baby warm, you're giving your baby love, you're tending to all of their needs, formula, breast milk, it's what makes baby healthy and mommy healthy and family healthy. That's what's most important. And even if you start out with a lot of formula, you can get to exclusive breastfeeding. And even if you start at exclusive breastfeeding, you may end up with exclusive formula. There's no right way of doing it. It's the right way for you and your family. And just so you also know, people do both. And people discount both. I don't know why both is not really accepted. It's like all or nothing. Both is very valid. And in fact, if you breastfeed your baby once per day, you and the baby are getting the benefits of breast milk. So please understand, it does not have to be exclusive breastfeeding in order to get the benefits. Now, let's talk about how we can make this more successful. So of course, I have a video on this. And I'm sure like you said, you've tried everything that a lot of people are trying. There's a lot of herbal supplements. There's a lot of different things that you can do. So my number one, you need a hospital grade pump. Number one, okay? Hospital grade pumps are different. Medelas are great. Amidas are great. I love them all, but you need a hospital grade pump if your milk supply is tanking, because hospital grade pumps have a stronger, more consistent motor, and they're just a better pump for bringing back a milk supply. Okay. Now, the next thing is you need to spend a lot of time with your baby skin to skin. So even if you've just fed your baby a bottle, one of the things you can do, remember, our bodies respond to our baby's smell and their touch and their sounds, like the warmth of their body. That's what our bodies were designed to respond to. So if you get yourself a hands-free pumping bra, which is so essential because then you have your hands free. What you do is you set up your pump with your hands-free pumping bra, and then you lay back a little bit and you take that baby in just a diaper and you put that baby up here, skin to skin, okay? And you cover yourselves with a blanket and you just smell your baby and love your baby and hold your baby. And every time you're pumping, try to do it that way. This is sending every signal to your body to make milk. Okay, a lot of women, when they're pumping at work, they'll have little pictures of their babies or they'll watch videos of their babies. They'll bring their baby's blanket in because they're trying to get that full sensory experience of their baby in order to help their milk come down. So when you're pumping at home, holding the baby, you're getting all of the go signals that your baby needs. Now, the next part is to work with a lactation consultant. Listen, there are so many complicated factors to why milk supply tanks, why pumping doesn't work. And these are things that you can't just read about. If your flange size is wrong on your pump, if it's too big or too small, that can affect milk. If the baby's tongue tied, another thing with preemie babies, they get used to that plastic in their mouth from a bottle, and then they won't latch to a breast well. But if you put a nipple shield over it, they feel that plastic in their mouth again, and they latch brilliantly. And especially if they're small until they get a little bit bigger, and then they'll just latch on their own regularly. But things with a nipple shield is you might not transfer enough milk and the baby might not eat enough. So you need a lactation consultant to come and help like assess that. Now, lactation consultants can sometimes be expensive, and I know this. So check your local hospital. See if your local hospital offers lactation services. La Leche League is a great resource for moms who don't have as much money to spend on lactation consultants, because La Leche League often runs like group breastfeeding like support groups, and you can bring your baby, and oftentimes the volunteers will help look at your latch while you're in group. And Women's Infant and Children, the WIC programs, those also are a potential resource. So women with lower income, if you apply for WIC and you're eligible, you can actually get, if you're breastfeeding, you can get extra food as part of that program. Well, they also have breastfeeding volunteers as part of that program. And a lot of these volunteers, they may not be a full IBCLC, but a lot of times they're a CLC, which is a certified lactation consultant. And they have training that they can go ahead and observe your breastfeeding and try to give you some tips or maybe hook you up with a lactation consultant. So these are several ways for you to potentially increase your milk supply. I definitely would tell you to check out some of the videos. There's so many like things that you could do. I could do a whole live just on that. But those are my couple quick things to help get you started, okay? And that's a really good question. For those of you who are joining us right now, my name is Dr. Samantha. I am the maternity mentor. Please feel free to put any of your questions into the chat. We're answering some of the questions that you have live, as well as questions that you guys have put onto the videos this week. So I got a good question on baby aspirin. So my wife has been experiencing vaginal bleeding until now. She is 5 months and 2 weeks pregnant. She started taking aspirin 81 milligrams 2 months ago when she was 3 months pregnant. The doctor said that my wife is having a partial placental abruption. The doctor told us to stop taking aspirin, but another said to continue taking it. My wife has normal vitals. She's not a HB. I think that's high blood pressure, but I'm not sure. But our baby is through IVF. That's the reason when she recommended to take aspirin. What are your thoughts about this? So this is a great question. So it used to be back in the day that we thought baby aspirin helped to prevent miscarriage. Baby aspirin helps to thin out the blood. It helps to prevent blood clots. Okay. So one of the theories behind miscarriages was that there were little microclots sitting behind the placenta. So this is the placenta. It's an organ that feeds your baby. This is what the umbilical cord is attached to. And this is your uterine wall, and it attaches here. And this side has a whole bunch of blood vessels, and this side has a whole bunch of blood vessels, because everything needs to go back and forth through these blood vessels that are attached. Well, if this gets a whole bunch of microclots, little teeny tiny clots, the placenta isn't going to function as well. And so the thought is that that's what was happening and causing miscarriages. And so we told people to go ahead and go on baby aspirin. That really has been disproven, or there's not a lot of evidence to support it. So it's not at this time supported for that use. Now, there is a lot of evidence to show that if you're at risk for preeclampsia, which we have a video on preeclampsia, we can link into the description. That's a condition that can be life-threatening for both mom and baby, and it's characterized by high blood pressure and organ failure. So with risk or diagnosis of preeclampsia, baby aspirin is absolutely indicated and can really go a long way to make you have a healthy pregnancy and a healthy baby. So from that perspective, baby aspirin is recommended. Now, what's interesting here is in the question, we talk about a partial placental abruption. Okay, what is this? Again, you got your placenta. Your placenta is supposed to attach firmly to the side of the uterus. And when we say firmly, the entire placenta, all of it, the whole surface, the whole edges attach into the uterus. That's what's supposed to happen. Now, an abruption is where part of the placenta comes off. Okay. Now, a complete abruption, the whole thing comes off. This is a medical emergency. This is a medical emergency, and both mom and baby can die within a couple minutes. So this is a absolute huge issue. Abruptions usually come with a lot of pain. Okay, severe abdominal pain. So if you have any pain in your belly, you need to get it checked out because you don't know what's going on. Now, in a partial abruption, a piece comes off. Now, it could be an edge. It could be part of the center. There's no way to know for sure. It's not like a guaranteed what's going to happen. And we don't always know what causes an abruption. Now, what happens with an abruption is now this part of the placenta, let's say just this part, it's exposed. So all these blood vessels can start bleeding. So one of the symptoms of a abruption is bleeding. So now think about it. If you have baby aspirin on board, you're going to bleed more, right? You're going to bleed more and more and more. So that's why it becomes a risk. So my guess is the doctor who's telling you to stop taking the baby aspirin is worried about the bleeding issue. However, the other doctor who's telling you to take the baby aspirin may be telling you because of risks related to preeclampsia, or maybe they're thinking it would prevent a miscarriage. Now, one of the things that if this placental abruption, this tiny piece that basically stays open, if it clots off and never opens up again, then it's possible you would be eligible to take baby aspirin. But if you're actively bleeding, that seems not like a great plan. What do? You get a second opinion. Flat out, straight up, you get a second opinion. A lot of people are blindly trust their IVF doctors. I love IVF doctors. Please, understand it's not a knock against an IVF doctor. However, just because you have the greatest IVF doctor or you're paying the most amount of money for an IVF doctor does not mean they know everything. And therefore, you should not just go with their opinion because this is the process you're going through. Additionally, your OBGYN or your midwife may be the most fantastic person in the whole wide world. You may have been with that OBGYN or midwife forever. That does not mean they know everything in the world. Second opinions are valid. Now, if you are actively bleeding with a placental abruption, you need to get that second opinion in a hospital. Okay. You do not just sit around making appointments. You go to a hospital and get checked out there. But ultimately, I would be going back to these providers, both of them, if you are stable and saying, I need a better explanation. Why? What are the risks? What are the benefits? And give me more than just this. Give me percentages. Give me scenarios. Let me make an informed, educated decision, which you're allowed to ask for that information. For those of you who are joining us, welcome. Please feel free to put any of your questions into the chat. Okay, so we had a question on second trimester bleeding, and it said, it's my 15th week and I'm suffering from heavy bleeding since yesterday. I visited my gynecologist last night. She suggested an IVFC injection and cyclogest pessary vaginal medication for 14 days. My baby is safe, but heavy clots of blood are present in my lower part, which will cause painful bleeding with clots. Please suggest something for me. So unfortunately, there's not much to suggest. So once we get into the second trimester, bleeding becomes more tricky. First trimester bleeding is a lot more common than second trimester. And the most important thing is to figure out what's going on. So there's a couple reasons why you might be having some bleeding in the second trimester. And one of the major ones is placental issues. We just talked about a placental abruption, that partial peeling away of the placenta, that can cause a lot of bleeding. The second thing is if you have your uterus and you have your cervix, there's something called placenta previa. And placenta previa is where your placenta grows over the cervix. And if you start to dilate, you're going to have blood coming through that. And that can be a serious medical complication. So you guys want to make sure that you're getting assessed and understand what's causing it. Are you going into preterm labor? Are you dilating? What's going on with the placenta? Do you have any infections? The most important thing with second trimester bleeding is determining the cause. And 9 times out of 10 with heavy bleeding, we can find a cause. It's an infection or it's a placental issue or preterm labor. Those are the top 3. So it's very important that you guys get that checked out. We had a question on gestational diabetes. It said, I'm on insulin resistance. But it makes me so ill that I'm having difficulty in breathing, chest pain, back pain, dizziness, and I feel weak. So I decided to stop taking it. Is it necessary to stick to it? I'm on a diet. Please help. So I think she meant that she was on insulin for her gestational diabetes. Okay. So let's talk about gestational diabetes. Gestational diabetes is absolutely horrendous. It used to be that in your 28-week pregnancy, approximately, you would go in for this sugar test. And they basically, what they do is they would sit you down and they'd have you drink this sugary drink and they would test your blood once. And if it was good, you passed. And if it was bad, you did a 3-hour version of it. Nowadays, they're trying to switch the criteria, and it looks like at some point in time it may switch that if the first one's bad, it's a wrap. You have gestational diabetes. Why is gestational diabetes bad? So I want you to think about diabetes in an adult. One of the things that happens with diabetes in an adult is diabetic neuropathy. This is where people start to lose sensation in their hands and their feet, and their legs especially stop getting good blood flow. Okay, and this has to do with the diabetes process basically destroys your system. It's terrible, right? So here's the thing. Your circulation is affected by diabetes. And now imagine a placenta. The placenta is all circulation. That's the whole job, is to circulate blood and nutrients and all this other good stuff to your baby. So when you have gestational diabetes, this placenta is not functioning to its optimal level. And then you have babies that grow big and giant. Okay. So we always think about, making sure a baby's big enough. But gestational diabetes babies are often way big, which means moms end up having a C-section, which is a more dangerous delivery. But in addition, this big giant baby comes out who's actually very medically fragile and often needs to be in the neonatal intensive care unit for weeks because the baby was used to so much sugar. Their insulin does not work right. Their pancreas does not work right. And they end up tanking. And they have so little sugar in their system in about an hour or 2 after birth that they can get brain damage. So we have to bring them to the intensive care and give them IV fluids with sugar in it until we can help manage their bodies a little bit better. They don't eat well. You're at high risk for stillbirth, a late stillbirth at like 38, 39 weeks when you have gestational diabetes. It's just not a good picture. And I have a video on gestational diabetes if you want some more information, okay? So now we have to try to control your sugar. So a lot of times they'll tell you to try to manage your diet and they retest you very quickly. But if you can't manage it with diet alone, they put you on insulin. Now, if you are familiar with diabetes in the adult world, you'll know that there's a lot of different treatments for diabetes. In fact, most people don't use insulin anymore. They use pills, they use these long-acting injections, all this other stuff. You cannot do that in pregnancy. And if somebody tries to offer you a pill for your diabetes, I would ask them to put you on insulin. Now, a lot of people don't want to do an injection. It's scary. It's needles. It's this and that. It's the teeniest, tiniest little tiny needle. It goes like right here. You can ask your best friend, your coworker, your like anybody, just pop it in, okay? It does not hurt. But the insulin works quickly. We need to control your blood sugar quickly. Your baby does not have months for us to figure it out. We have sometimes days or weeks. And so we want to get that under control as fast as we can to ensure that the placenta works as good as it can for the longest it can. And so that your baby is not that big giant baby who can't control their sugar. Okay. Now, if you're going to be taking insulin, though, unfortunately, you have to start testing your blood sugar, okay? You cannot just take insulin because if you are using the diet as well, which you should be told to modify your diet, if the diet starts to work, your blood sugar might be normal and then you shouldn't give yourself insulin. Insulin should be given under parameters. That means they give you directions on when or when not to give it, and it's based off your blood sugar. So the proper, safe way to give insulin is to first take your blood sugar, make sure you're in the parameter to give it, and then you give it. And so if your doctor is not having you check your blood sugars regularly, you need to go back to them and ask why. Because at that point in time, the insulin is not safe. Signs that your blood sugar is too low. Chest pain, difficulty breathing, back pain, dizziness, feeling weak. Those are all the symptoms this viewer reported. Now, those could be symptoms of other things. So let me tell you guys all. If you're having difficulty breathing or having chest pain, please call 911 or go to a hospital. You do not answer. That chest pain and difficulty breathing are a no-go. You need immediate emergency care. However, if this is caused by low blood sugar, you then need to follow up with your healthcare provider and figure out what the right dosing is for you. Okay. For those of you who are joining us, welcome, welcome. I only have a couple more questions left. So if you guys have any questions, please feel free to put them into the chat. So we had a question on like what to expect on the first 3 hours after a vaginal delivery. And this question was, is it okay to put antibacterial hand soap with warm water into a peri bottle for when you get ready to squirt on the stitches? Okay. So when you give birth, whether it's a C-section or a vaginal birth, both, you have a lot of people in your business, okay? And when I mean in your business, I mean in your vagina and I mean in your uterus, okay? If you are trying to have a vaginal birth that ends up in a C-section, leading into that, you had a lot of vaginal checks, vaginal birth, I mean, there's just everything's all down there. And even in a planned C-section, you know, we're not directly going into the vagina, but from the upper end, we're messing around with the uterus and everything goes downhill from there, right, into the vagina. So the blood that's coming out is not clean blood. What do I mean by this? Despite a lot of the taboos all over the world, your period menstruation is actually clean blood. This is the normal shedding of the uterine lining. It's just simply because the uterus starts to overgrow, waiting for a pregnancy to happen. And when that pregnancy doesn't happen, the uterine lining sheds to start new so that you can hopefully successfully get pregnant the next month. That blood is clean because nobody's up in there messing around. Now, when you're in labor, we will check you and stuff, and we are all using sterile technique, okay? So we're using sterile gloves and we're doing all these things to protect you, but it's not perfect, okay? It's never going to be perfect, and therefore, everything that's coming out is dirty blood. And so you'll be instructed to do two things. Now, whether you've had a C-section or a vaginal birth, the vagina is usually sensitive, but especially after a vaginal birth. So when you go to the bathroom, we tell you two things. Every single time, no matter what, change your pad, even if there's no blood on it. So let me say this again, ladies. Every single time for 6 weeks, if you are wearing a pad, because maybe you're still having a little bit of clear discharge every once in a while, a little bit of whatever, you change that pad. Because any bit of bacteria that's on there is potentially going to go back up and cause an infection. Okay? Most women stop wearing a pad around 3 or 4 weeks. So you're not going to be wearing it the full 6 weeks, but that's what you do. And nothing goes in the vagina for 6 weeks. Why don't we want you using tampons? Because that is dirty blood full of bacteria. And that tampon holding it up in there can cause a major infection, including not only toxoplasmosis, other things, and it can be a medical emergency. So you need to wear pads. You need to let the blood come out. You need to change your pad every time. You also need to clean. Now, if you've had a vaginal birth, you are not going to want to wipe. So normally we go to the bathroom, we wipe, toilet paper or rag or whatever you use, front to back, okay? But when you've had birth, your vagina hurts. It's often swollen. You may have lacerations or an episiotomy. We have a video on that. We can link that into the description. So you can't wipe. That would be excruciating. So we give you this bottle. It's a peri bottle. It's about this big and it's soft plastic, and you fill it up with water and you squirt that water onto your vagina to help wash away all of that dirty blood and bacteria I just told you about. Then you take a little bit of toilet paper and you pat dry, and then that's it. You have your clean pad, you go about your business. Now, the peri bottle, this question says, can I put antibacterial soap in it? So when you're in the hospital, a lot of times you'll see us, we'll fill it up with soapy water. So we get the hand soap that's in the bathroom and we put a little bit in, and then we fill it up with warm water. And that's how we teach you how to, wash your stuff. You do not need soap. Okay. So that's the first thing. If your vagina is super sensitive, then you may not need soap. For example, I had cancer when I was younger, and I can't use anything with scents or with dyes or anything down on my vagina. I can't. So I would not want to have soap in there, or I'd want a very, very mild soap. Some people use their baby shampoo that they'll get in the hospital to help wash the baby. It's like whatever you want. So antibacterial soap, absolutely. Some of you guys may not want to use soap at all. So you do not have to use soap either. Okay. The idea is just it's rinsing away that bacteria. And if you fill this bottle this much and you start squirting it on your vagina, I mean, believe me, you're going to get halfway through and wonder, like, really, is there anything else dirty down there? Because it's a lot of water. The other thing is we tend to teach women to use warm water. But if your preference is cold water, there's nothing wrong with that. Some women prefer cool or cold water because they're very swollen and it feels kind of refreshing and it helps ease some of the pain. Okay. So the biggest thing, as long as you're not having any kind of reaction, you can use whatever you want. Using antibacterial soap is not going to prevent infection. So if your goal for using it is to prevent infection, that's not really going to do anything because it's literally being washed away. Okay. The more important thing is good hand hygiene, changing that pad, and rinsing well every single time. Okay. For those of you who are joining us, I'm finishing up. So if you have any questions, please feel free to put them in the chat, but I'm on my last one. And this wasn't really a question. It was a comment, but it's on one of my favorite topics. I mean, I'm passionate about most of these topics, but I like this topic particularly. So I'm throwing up 5 times per day throughout the day. It seems like it's the worst when I finally get home and get some rest or lay down. I barely sleep for an hour at a time. I wake up and run to the bathroom. I don't know what to do. I feel like I'm being a big baby and overreacting, but this is miserable. Okay, so this was put onto our hyperemesis video. Hyperemesis gravidarum is a severe form of morning sickness, which we all now know is like all day, anytime, any place sickness. I'm very passionate about hyperemesis gravidarum for 2 reasons. One, I suffered from it. So I understand exactly what it feels like. But 2, in psychiatry, this is actually an area that I'm very passionate about women getting the best care they can, because hyperemesis gravidarum is so severe, it can actually cause PTSD. Okay. So PTSD is post-traumatic stress disorder. I mean, this is a real deal. It is extremely hard to function when you're not eating well, when you're constantly worried about where the closest bathroom is. I mean, women who suffer from really bad hyperemesis, they don't even want to go out because you don't want to throw up in a public bathroom. You don't want to throw up on the side of the road. I mean, these are very horrible things. And so you end up feeling very isolated and alone. A lot of people will look at you and they'll be like, come on, man, this is like nausea. This is vomiting. Like, get over it. Like she said, a big baby, but it's more than that. Okay. start to worry about the baby, you start to worry about yourself. Okay. So for any of you guys who know anybody who's suffering from hyperemesis, like definitely have sympathy and empathy for them. Listen, if you are somebody who's trying to support somebody else and they're, complaining a little bit more than you like or something like that, that's cool. Just like try to be supportive and distance yourself a little bit. It's totally cool. But just understand it may be as bad as they're saying. I remember there were times that I would take a bite and like close my eyes and just say, I just need to keep it in my mouth for 10 minutes, just 10 minutes. And I go bite by bite. It's really, really that bad. So what can you do for hyperemesis? I mean, we have a video on it. There are a lot of medications that you can take now, and technology's gotten so much better. Like there's Zofran pumps, which are these little pumps of medication that they put a little needle under your skin and it'll just sit there and infuse all the time some of this medication. There's other things like diclegis, and diclegis is actually 2 over-the-counter medications put together. It's vitamin B6 and it's Unisom. And these 2 things together actually help with nausea and morning sickness a lot. So that's another very safe way to, take care of it. And then there's lots of other stuff, homeopathic stuff. I mean, lots of women will tell you that if they drink really hot drinks or really cold drinks, it helps their nausea. Motion sickness bands, the C bands, those aren't going to work for everybody, but they do actually work for some people. If you're cleared by your healthcare provider, you can even try acupuncture or, certain types of acupressure, as long as you're dealing with a certified provider. So there's lots and lots of options for you if you are suffering. The biggest thing is just get through one day at a time. Our bodies are amazing. They will strip us dry to make sure your baby is healthy. So even though you may not be eating a lot, your baby can still be nice and big and a healthy pregnancy. I lost 30 pounds with one of my pregnancies. I mean, it was bad, but my babies came out and they're great. The other thing is, for those of you who are suffering, and if you suffer up to the very end, right, you will feel better immediately. Like the second that alien leaves your body, you feel better instantly. That is the one advantage of Hyperemesis Gravidarum. Kind of towards the end, but the nice thing is you don't have to dread the newborn period. You will be able to enjoy your baby. You won't be throwing up everywhere. Once you are delivered, all those hormones that are causing all of that, they go away. Hey, Tess, can you remind me the recommended time interval between a first and second baby? What is a healthy gap in pregnancies? 2 years from the time you deliver to the time you should start trying is the recommended time. So if baby is born on January 1st, you are not actually going to try getting pregnant until the baby's second birthday. So it's not from the time you get pregnant to the time you get pregnant. It's from birth to pregnancy. So the reason for 2 years is that in an ideal world, you are breastfeeding for a full 2 years. Now, in this country, we actually try to encourage women to go to 1 year. And that's because it is a very, very big goal to go to 1 year. For women who are able to accomplish that goal, it's amazing. I mean, every day you guys breastfeed is amazing, really. It's hard work. It's a lot. But the WHO standard is 2 years. And the 2 years that you're breastfeeding, generally speaking, back in the day, used to mean that you weren't ovulating. Now, that's not the case anymore, but back in the day, that's what it meant. And because you weren't ovulating, you couldn't get pregnant. Now, the reason for the 2 years, well, babies get a lot of nutrition from that breast milk in the first 2 years. And especially if you're in countries where there's not as much food and where water supplies can be not as clean as they should be and stuff like that, breastfeeding a baby to 2 years old can really help to improve their quality of life and their long-term health. But in addition, it allows the mom's body to heal. Okay, it took 10 months to grow that baby. Okay, at a minimum, it takes 10 months to get your body back to normal. But most women who've had a baby are going to say, once you have that baby, even after the 10 months, things are just still not where they were before. You probably aren't exercising the way you used to. You probably aren't eating the way you used to. You're definitely not sleeping the way you used to. your entire stress level has changed, your family dynamics have changed, and therefore those are all other intangible things that we don't think about that go into that full healing process. But yes, it should be 2 years. So that's all I have for you guys. I want you to know we are going to have some videos coming up. I know we've taken a couple weeks. We've got some good stuff in the line, so there are videos coming up. Remember, please share the family. Please share the channel with your friends and family. Follow me on Facebook, Instagram, and Twitter for additional content. We are here every Monday at 9 p.m. Eastern Standard Time to answer your questions live, as well as questions you put onto the videos in all of the comments. I read those comments, I respond to those comments, or my husband will also respond. We take this very seriously. If you guys want a video, just put it as a comment on one of the other videos. We see them and we will definitely do our best to put that content out. You guys sometimes have the greatest suggestions because a lot of you guys are right there in it. So please let me know what you want to see. Again, I'm here every Monday at 9 p.m. Eastern Standard Time. Please subscribe to the channel. Please like the videos and hit the notification bell so you get notified when we put out a new video. It really, really, really helps me out. I really appreciate it. I love talking to you guys. Thank you so much for joining me. My name is Dr. Samantha. I'm the maternity mentor. Bye for now.